Good evening, everyone. We have today with us Dr. Colonel C.S. Pant, who is a Vishish Seva Medal awardee and pioneered breast imaging and detection in India. He is currently pursuing dedicated practice at Colonel Pant's Imaging Center and Fortis La Femme, New Delhi. He is the president of Indian Radiology and Imaging Association and a regular past president and a regular speaker at number of international and national forums and conferences on breast imaging and cancer. He's also authored a few books and is truly a pioneer. And we are so glad to have you with us, sir. Thank you so much.
Thank you, Ishita. Thank you for having me over here. Thank you.
Thank you. Since October is the Pink Month, the Breast Cancer Awareness Month, that is the reason why we are holding this session today, a session on breast cancer awareness. So, sir, what causes breast cancer?
Oh, I think it's a very million-dollar question, Ishita, that you're asking. We don't know why cancer happens, but there are, as far as the breast cancer is concerned, there are some higher risk factors and there are some lower risk factors. The biggest factor in breast cancer is age, for some unknown reason that, you see, though a lot of people feel that the family history is important, but it only 8 to 10% people have a family history of breast cancer. 90% of the people who have breast cancer have no history of family history. The biggest risk factor in the breast cancer is the age. The risk starts at 40 and peaks between 50 and 75. In Western women, the mean age to develop breast cancer is around 55. For unknown reason, the breast cancer in Indian women peaks at 45. So we have early breast cancers, though are more aggressive. So these are the two main reasons for breast cancer. The other reasons which are very, very important, which we should know today's this thing is a lifestyle disease. You will see that these days a lot of women, they don't get married. If they get married, they don't have children. If they have children, they don't do breastfeeding. Alcohol has become very common these days in our young women. Then, the lack of exercise, obesity, stress. So there are so many minor factors which also affect. So I think beside age and the family history, one of the most important for today's generation is the lifestyle disease.
Definitely, sir. Lifestyle and stress, I think, are something which are root causes for a number of diseases. So, sir, what are the common symptoms to watch out for?
So, Ishita, again, unfortunately, early breast cancer has zero symptoms. When you have a symptom, there actually, basically, the symptom also is very deceptive. It is to begin with, the breast cancer starts as painless. And unfortunately, since we all relate our disease to pain, cancer to pain, unfortunately, a lot of women ignore it. We have seen that large number in our practice. I'm in practice of breast cancer early detection for almost now more than 36 years. And I have the privilege to start first breast cancer screening program in the country when I was posted in DRDO, Institute of Nuclear Medicine, way back in '86. We have seen that, so that is one thing which is very deceptive, that early breast cancer has zero symptoms because these are painless lumps, and by the time you feel a lump is already stage 2. The other presenting symptom which could be alarm is if you have a bloody nipple discharge. So these are the two: painless lump, which is when you feel it, and the bloody nipple discharge. Rest, the change in shape, change in breast shape, and the discoloration of the skin, retraction of the nipple. These are the few other things which one can present with, change in shape, one becoming smaller than the other, so that also can also be sometimes a presenting symptom. Mostly it is a painless lump, which is first sign which is noticed by the woman.
So, sir, since you mentioned that you started the first cancer screening program in 1986, I would like to know when should we begin screening for breast cancer?
Ishita, again, these are controversial topics. You know, I started something which is just you give introduction, Breast Imaging Society of India. This was started by me as a founder president in 2013. So the Breast Imaging Society now encompasses, earlier we had only 10 members, now we are almost 600 plus, we are dedicated radiologists. And we have come out with this thing that since in Indian population, the breast cancer occurs early, so we should start a screening at 40. And the American, US task force earlier they used to say once in 2 years, and now they have revised and they also say it's once a year now. The European people say once in 2 years. Unfortunately, for some unknown reason, the British people do once in 3 years. So I think you have to strike a balance, and in the Indian subcontinent, I think it's a good idea to start at the age of 40 if people can afford. And then a couple of years, one should go once a year. And then if the things stabilizes, then probably you can take it to 18 months or so. Yeah.
Sir, can men also get breast cancer?
Of course, Ishita, the 1% this thing of the men can get it. But the thing is about the men getting breast cancer is that detection is early, because you see, since most of the men don't have any fat on their breast, so even the small thing, either it is a nipple discharge or lump, will be immediately picked up. So though it is 1% of the men get affected, but their detection is early because of no gland or the fat in the breast. So it is the nipple is very flat, and immediately if anything happens, it is picked up.
So, what are the treatment options that are available once the breast cancer is diagnosed?
Ishita, before I go to the treatment, I would like to emphasize on what you started with screening. See, what happens that we always say the breast cancer is curable if detected early. How do you detect it early? As I just said, that the first symptom of the breast cancer is a painless lump. If a lady feels a lump, or if a doctor feels a lump, it's already stage 2. Because there are a lot of studies have come that if the best fingers in the world can pick up the lump when it is more than 2 centimeter. So anything which is less than 2 centimeter, which is stage 1 disease, as this thing. Other thing which we rarely pick up by screening is that we pick up this microcalcification, tiny little dots, which represent the earliest form of breast cancer. So I think it is very, very important that every woman must starting screening program at the age of 40, so that if anything is developed, whether it is a microcalcification or it is a cancerous lump, it is picked up much before it can be felt. And then what you are asking next question is the treatment starts. Stage 1, which is fully curable with a small surgery, breast conservation, with no chemotherapy in large number of cases, is ideal. But stage 1, which is again say fully curable, is only detected by screening. But since I'm in the screening program for many years, women, all educated women, we have been dealing with metropolis only. All educated women are scared of getting this. Oh, if something comes out, then what will happen? So they want to be, denial. So instead of denial, I'll through your medium, I would like to request all the women who are 40 plus, please do it. So there are two advantages of doing it: routine mammography, and it should start with the mammography, and if required, then ultrasound, not other way around. Because ultrasound doesn't pick up early breast cancer if it is a fatty breast. Ultrasound doesn't pick up microcalcification on this thing. So it should be done in mammography first, and mammography to be done followed by ultrasound if the breast is dense, which we generally see in premenopausal women, and that is how it is important. So if the treatment, when you are asking about the treatment is dependent on what stage it has been diagnosed. As you know, the cancer has 4 stages. Stage 1, less than 2 centimeter, stage 2, more 2 to 5 centimeter, stage 3, more than 5 centimeter, stage 4, when it has affected the other body. So the depend upon at what stage the treatment, the cancer has been detected, the treatment will be according to this. Stage 1, which we would like that everyone should be picked up at stage 1 or at the most stage 2. That's a very good treatment. You have a small surgery, there's no breast removal, there's no chemotherapy in large number of patients, and only thing is because we are conserving the breast, we have radiotherapy, and that's an excellent outcome. Actually, I'll just read out one. Give me 2 minutes. There's a lady who came to us last week, and she's 47 years. Of course, for confidentiality, we will not reveal the name. She came to us for a routine mammography. She had come last year also in month of August, and now she came last month. And there's a tiny little cancerous growth which we picked up. It was a 1 centimeter this thing, which she was blissfully unaware. We did a core biopsy on her, and then we have these markers. So what you are talking about the treatment depends what are the markers. So now I'll read out that. So whenever we do biopsy, we do immunohistochemistry to know the aggressiveness of this thing. So this lady has she's 47 years old. The ER is positive, PR is positive. So it is a hormonal dependent, Then HER2/neu is again an aggressive this thing, which is negative. And then fourth thing, we talk about the proliferative index or KI. KI index is just 10%. Any KI index which is less than 15% is a win-win situation. So this lady, who was perfectly normal last year, has been picked up by stage 1 cancer with all positive parameters. So she'll undergo surgery, followed by radiotherapy, and because she's premenopausal, we'll give her some adjuvant chemotherapy. But she may not need chemotherapy because Ki-67 is less than 15. She'll be put on hormones. Normally, we put tamoxifen if it is a premenopausal, or aromatase inhibitor, it is postmenopausal.
Thank you, sir. Thank you for sharing that inspiring story and for highlighting how important screening is. Just like we saw with this story that sir shared, if detected as early as just 1 centimeter, now the prognosis of this cancer becomes so good. The lady is practically cancer-free, which is wonderful. Hey. Sir, but how quickly should one make a decision about breast cancer treatment? So it is detected with the screening.
I think the problem that once you are detected, there's no reason why you should delay it. It's not that it is very, luckily the breast cancer, unless it is one subtype, they're not very aggressive. So if it is premenopausal breast cancer detection, then one has to go as soon as possible, then there's no chance. Even in postmenopausal, once it is detected, why do you want to stay? You should get it removed, get it from your head and this thing, Sometimes, many times what happens that since you are asking one related thing I would like to share with you. We have seen in our practice, suddenly the educated women, they come with big lump and all that. I said, ma'am, kya hua? Aap kyun nahi aaye? Kyun nahi kara? Arey doctor sahab, mere बेटी का शादी थी या उसकी मेरी मौसी की लड़की की शादी थी या तो हमारी जो प्रायोरिटीज है ना विमेन वो हमेशा अपनी प्रायोरिटीज लास्ट में रखती हैं एक्चुअली उनको अपनी प्रायोरिटी फर्स्ट में रखनी चाहिए आई स्टिल रिमेंबर गुड ओल्ड डेज पता नहीं आपके टाइम पे था कि नहीं व्हेन आई वाज इन आर्मी तो माय फादर यूज्ड टू राइट मी अ लेटर है ना और उन दिनों इनलैंड लेटर होते थे ब्लू इनलैंड आई डोंट नो वेदर यू हैव सीन दोस नॉट अब तो ये ईमेल का जमाना है तो कुछ भी सब उसमें चलता है बट उन दिनों तो बाबूजी लिखा करते थे आई एम कुमाऊनी से इन आवर लैंग्वेज इज टू राइट कि अनलेस यू लुक आफ्टर योर हेल्थ you cannot look after others' health. And unfortunately, for whatever reason, women is one who's a center of the family. तो पहले उसको अपने हस्बैंड का काम करना है फिर उसको अपनी बच्चों का काम करना है फिर उसको अपने सास ससुर का काम करना है and she takes the last priority. In this case, we have seen large number of women who have presented with stage 2, stage 3 disease. The reason had been they were actually committed for something in the family function of family priorities than themselves. So, मेरी रिक्वेस्ट ही रहेगी आई विल बी रिक्वेस्टिंग ऑल द वुमेन हु आर लिसनिंग टू दिस कि यार फर्स्ट अपनी प्रायोरिटी रखो इफ यू हैव एनी इशू which is bothering you, especially in the breast, please go to the doctor immediately. Anything else can wait, not your disease. So that's very important message, which I would like to share with your all the audience. You know?
Absolutely. Sometimes those little acts of self-care and, understanding of oneself can make all the difference. No.
बहुत जरूरी है.
Bilkul, sir. Sir, any message that you would want to tell our listeners? Now, since this is the Breast Cancer Awareness Month and you've been doing wonderful job for screening and for awareness.
Ishita, one thing which I would like to tell all the women who are listening to this is don't be afraid of screening. Screening is life-saving. Breast cancer is curable if detected early. There's no question on that. And how it is detected is by routine screening. So don't be scared of getting a screening done. Whenever you cross 40, actually, we say that once you are 20 plus, you start doing your self-examination once a month. Once you are 30 plus, you should start going to a doctor once a year, clinical examination. Once you are 40, then you start, beside clinical examination, you must start doing your mammography regularly. So that there are two things happen. First thing is that if it is detected early, it is fully curable. Secondly, suppose it is not detected, you are normal. And if you give a gap of 1.5 years, so this is breast cancer per se are not very aggressive. Agar हमारा gap it is less than 1.5 years, even if something happens, what we use the word interval cancer, it is still stays at stage 1. So once you get your baseline mammography, it gives you a kind of a reassurance. Yaar, 1.5 saal you are relaxed. Unless something aggressive tumor happens, there are very few. Then you'll come to know, because there'll be skin changes, there'll be nipple changes, there'll be feeling of lump and all that. Otherwise, by and large, you can take it easy. So even 18 months, ideally it should be 1 year, but 18 months also is doable, So go to this thing, don't be scared. There are a lot of myths which are associated with the mammography. Oh, it is very painful. So we have a very high standard mammogram machine, which have what we use the word op compression device. It senses the optimum compression. There's no that. There are a lot of myths going around. Oh, if we do it routinely every year, and unfortunately, Ishita, sorry for this myth has been spread by our doctors colleagues. क्यों नहीं यार हर एक साल मत करवाना वो radiation है.
Radiation.
No, all of us are exposed to radiation in the natural background, which is equivalent to 7 mammography in a year. 8 mammography is not going to do any harm to you, but if detected early, it can going to save your life. Yeah. So yes, I think screening should be buzzword. Every woman who is 40 plus must go for mammography every year to pick up any early breast cancer. Yeah.
Yes, absolutely, sir. And I had read a quote somewhere, your talk about how one should not be afraid. That just brought back that quote to me. You're stronger than you believe, you're braver than you seem, and smarter than you think. So please, focus on yourself. You come first.
Absolutely, absolutely.
And the theme for 2023 Pink Month is Pink Together, Stronger Forever. So all of us, all doctors are here for you. If you feel there is anything, come to us. Even if you do not feel there is anything, please get the screening done. As Dr. Pant rightly mentioned, India, we have the breast cancer incidence begins at a lower age. So you need not wait till you get old, 50.
Sorry for interruption, Ishita. One fact also I'd like to hear here. There was a WHO study a few years where 65% of the Indian women are diagnosed stage 3, whereas 65% of the Western women are diagnosed stage 1 because of the regular screening. And as you asked me a question, so the treatment becomes more aggressive as the stages enhance, and the longevity comes down. So it becomes more expensive and very compromised life. So it's important. Sorry for interruption.
No, I think you've very rightly pointed out, and if all of us are self-aware, I think we can reverse the numbers, and that is what we all doctors hope for. That we detect the cancer as early as possible, that so that you all can live a cancer-free life. Why the
Absolutely.
cancer happens, we do not know that. As Dr. Pant very rightly said in the start, we do not know why it happens, but we know how it can be treated. And the early it can be treated, the better the chances are. So let's work together for the breast cancer awareness. Let take care of yourself and keep yourself first. Thank you so much, Dr. Pant, for joining us. It was a wonderful session.
Thank you, Shira. Thank you for having me over. Thank you. Okay.
Thank you, sir.